Speaker, I'm pleased to rise to speak to Bill C-36, what the government has named as the Protecting Canada's Seniors Act. I'm pleased to do so not only as a senior myself, but on behalf of a riding that has one of the greatest concentrations of senior citizens anywhere in the country. For legislation with such a grand title, its enactment is actually only one clause long. Simply put, it adds to the Criminal Code section on sentencing a one-line addition. The judges are to consider, and I quote, evidence that the offence had a significant impact on the victim due to age and other personal circumstances, including health and financial situation, unquote. Essentially, this bill seeks to increase sentences for offenders who abuse our seniors in the commission of any offence. Itself a very worthwhile goal, as the Parliamentary Secretary to the Minister of Justice outlined in his remarks. The seriousness and scope of the problem of elder abuse has been discussed over the course as well of our analysis of this legislation in committee, but it warrants attention yet again. A number of studies have suggested that as many as 10% of the seniors in Canada may be subjected to some form of elder abuse. Yet the true figure, as the witness testimony before our committee put again and again, the true figure is likely much greater than that, as many cases go unreported. Indeed, underreporting often due inter alia to the close or even dependent relationship between victim and victimizer, as well as the isolation of many seniors and their frequent lack of awareness about the resources that may be available to them, makes elder abuse a very complex crime to detect, to prosecute, and in particular, to prevent. Accordingly, Mr. Speaker, if the issue of elder abuse is to become a national priority, if it is to be effectively addressed and redressed, a concerted effort extending across party lines will be required. In that connection, I am pleased that our committee meetings on C-36 generally took place in an open spirit of nonpartisan cooperation. It is a good bill, but there is much more that must be done. Allow me, Mr. Speaker, to move on to the second part of my remarks and to elaborate on that which can be done and indeed needs to be done in this regard. First, it is crucial, and a colleague from Pierrefonds Dollard addressed this as well, it is crucial to raise awareness among all Canadians that the abuse of seniors is a significant problem, one that is simply unacceptable. Programs such as the Federal Elder Abuse Initiative, mentioned by the Parliamentary Secretary, are a welcome beginning, but efforts in this regard must be continued and intensified. The government can do this by establishing its own set of programs, as well as helping to fund those that are run by the provinces and by non-governmental organizations, and warrant further support. Increased awareness is required on a variety of fronts. Not only must everyone be made generally aware of elder abuse, but professionals who work with the elderly require training so that they will know how to properly care for seniors, how to recognize signs of abuse, how to minimize patient-to-patient abuse in institutional settings. Family members should be made aware of things that they might be doing that perhaps they might not have considered to be abusive, but have detrimental effects on the seniors in their lives. Third parties need to understand that silence in the face of abuse is intolerable, Mr. Speaker, and that resources exist for dealing with abuse if indeed it is reported and acted upon. And of course, seniors themselves are too often ashamed of abuse. They themselves will minimize it and may indeed indulge what is a completely unacceptable situation. It is therefore critical that seniors be made aware that abuse is not something to be tolerated and that a range of options exist for addressing and redressing it. That alternatives to the criminal justice system do in fact exist in this regard. Indeed, our seniors must be encouraged to confide in a doctor or call an elder abuse hotline. They need to be told that both hope and help are out there. Second, Mr. Speaker, in addition to raising awareness, the federal government can take the lead in enhancing our understanding of the nature and scope of elder abuse in Canada. Last year's committee report and the witness testimony before our Justice Committee focused a great deal of attention on the fact that data on elder abuse is sorely lacking, and that effective action will be difficult to take without a fuller understanding of the problem. According to the Ontario Network for the Prevention of Elder Abuse, most agencies do not keep information on the number of cases reported or responded to, and without national standards of collecting statistics about elder abuse, we are simply left patching together data from different studies with different scopes and methodologies, along with anecdotal evidence from a patchwork of jurisdictions. HRSDC has funded preparatory work for national prevalence study through the National Initiative for the Care of the Elderly, again referred to earlier. And a good way for the government to demonstrate its seriousness on this file would be to ensure high-level and sustained funding for the study itself and its recommendations. A third recommendation that was mentioned in the report and that arose frequently again in our committee meetings on C-36 was a need for increased funding and support for institutions, often non-profit organizations that do so much of the on-the-ground work in the fight against elder abuse. We met some remarkable people at committee who work daily to protect seniors, and I commend their efforts and those of other professionals who are instrumental in preventing, in detecting, and addressing elder abuse. They described to us some truly appalling cases of mistreatment, yet they remain undeterred in their tireless and noble service to seniors and therefore, in effect, to all of us. We should be very grateful to them and very proud of their good work, which we commend them for and trust that it will continue. Mr. Speaker, one can hope that such dedicated individuals will therefore continue their good work regardless of government funding. But we need not equivocate with respect to such a commitment. Groups need financial and other resources to hire and train responders to intervene in cases of elder abuse, to set up elder shelters, logements abordables, comme mon collègue de Pierrefonds Dollard a dit, elder abuse hotlines and victim support services, and to develop pioneering initiatives such as financial literacy programs for seniors that help the elderly to protect themselves from fraud. The federal government must be at the forefront of funding and nurturing such activities, et aussi, comme mon collègue de Pierrefonds Dollard a dit, de les aider d'échapper de pauvreté. Inadequate funding of such organizations can have an impact in ways we do not always consider. As was explained at committee by a member of the Elder Abuse Intervention team from Edmonton's Catholic Social Services, who talked about how important it is for instances of elder abuse to be handled by experienced staff. Unfortunately, cases of elder abuse are too often dealt with by people who may lack the necessary experience, as the organization's inability to offer high-paying jobs leads to employee turnover and employees leaving after a short period of time. A lack of resources may also mean that when people do as they are told by public awareness campaigns and report abuse, organizations may then become overloaded and unable to respond precisely because they don't have the resources to begin with. As a result, people who report abuse become understandably frustrated and less likely to report it in the future. Ultimately, these organizations are doing impressive things with very limited resources, but again, they need more government support. Fourth, Mr. Speaker, the federal government can also do more to help address systemic inadequacies that are at the root of many cases of elder abuse. And the witness testimony before our committee highlighted a number of these systemic inadequacies. Employees in healthcare facilities are often faced with an excessive workload and long hours, factors which, especially when combined with inadequate training, can create an environment in which elder abuse is more likely to occur. Better training is required, particularly to help workers detect and deal with patient-to-patient mistreatment, a form of elder abuse that often goes unnoticed. As well, overcrowding can lead to an elderly patient being repeatedly transferred from one institution to another, a state of affairs that one witness at committee said should qualify as institutionalized abuse. Fifth, and as a corollary to this point, increased funding for home care might help with overcrowding by keeping many seniors out of institutions in the first place and by thereby distributing the responsibility. Even though most of these institutions operate under provincial jurisdictions, although veteran hospitals, for example, are federally run, the federal government has a clear role to play in helping to ensure adequate health care funding. When health transfers are clawed back, it becomes that much more difficult for the provinces to address these issues. 6, Mr. Speaker, at the same time as we tackle these systemic problems to which I have referred, we must also deal with those specific individuals who abuse the elderly. That is what C-36 attempts to do, but there are a number of other ways that elder abuse can be addressed from a criminal justice perspective. The Minister said at committee that he recognizes the important role that law enforcement officers and other legal professionals can play in, again, preventing, detecting and intervening in cases of elder abuse. I was glad to hear that perspective taken, and I hope to see that recognition translate itself into action. But better training required for police officers and for officers of the court in how to deal with seniors is something that needs to be put into place. Young police officers may not always know, for example, how best to gain the trust of an elderly victim, and lawyers who prosecute elder abuse cases may need to adjust their interrogation techniques to make them more effective with certain seniors. Another way of increasing the effectiveness of legal professionals is to include them as part of multidisciplinary teams, a recommendation that was made by almost each one of the witnesses who appeared before us, such as exist already in certain parts of the country and in those of the witness testimonies who made references to them. When elder abuse is detected, police officers, social workers, and healthcare professionals can coordinate from the start to ensure that the situation is dealt with appropriately from a social and medical perspective, as well as from a legal one. For our part, as legislators, we should consider certain changes to the criminal code that can have a greater impact than C-36. Witnesses at committee raised the possibility of enacting specific elder abuse laws that would complement those already in place in provinces and territories. In addition, the committee discussed whether a mandatory reporting law for elder abuse might be appropriate. One witness, a social worker from Alberta, told us that he has a legal duty to report the abuse of a child, but no such duty to report the abuse of a senior citizen by contrast, Mr. Speaker. In general, there seemed to be support among the professionals we heard for a law that would require at least those who encounter abuse in the course of their professional duties to report it to the authorities. Such a law could supersede certain confidentiality barriers so that those who encounter abuse are not professionally bound to keep it secret. For example, bank employees sometimes suspect that a senior is being taken advantage of financially, but they are unsure of whether they are permitted to do anything about it. Clarifying the legal obligations of such an individual could help stem the tide of financial abuse of the elderly. These, Mr. Speaker, are just some of the many ways that the government could truly be, quote-unquote, protecting Canada's seniors. I appreciate that the Minister and the Conservative members of the committee agreed that C-36 alone is not enough, but they have yet to put forward sufficient, concrete, substantive measures in the realm of health care, research and justice, and they have yet to provide adequate support for community initiatives. Instead, regrettably, health care transfers have been reduced, old age security has been cut back, and attempts to deal with the problem through the criminal code, while acceptable as far as it goes, focuses only on punishment, again after the fact, and not on the necessary prevention itself. Seniors could be forgiven if looking at this one line, Protecting Canada's Seniors Act, and wondering where the rest of it is.